All right, go ahead and put the headphones on. When the door closes, we'll get the test started.
They're getting screened, poked at with needles, filling out paperwork, and ultimately their medical file is turning green. Operation Capital Medic, a medical readiness mission held at Fort Belvoir Community Hospital for over a year now, is increasing the readiness of service members in the Washington, D.C. area. It is estimated that about 5,000 Reserve and National Guard soldiers live in the Washington, D.C. area, and the Army Reserve Medical Command, 7250th Medical Support Unit, has provided medical and dental services to nearly 1,500 of them, helping them get off the red list, one soldier at a time. Soldiers in need of a PHA don't need an appointment to receive care at Operation Capital Medic, which provides services quarterly. But many units in the area coordinate for their soldiers to show up during that weekend in or out of uniform. Word is getting around about the services being provided at Fort Belvoir Community Hospital, and about 450 soldiers were expected to show up for services provided November 3rd and 4th. Despite this large number, one soldier from the 3200th Strategic Intelligence Group said,
"Probably one of the best medical SRPs that I've gone to. The ability to utilize the hospital in its respected areas for immunization, PHA, hearing, vision, HIV, blood draw, it made a huge difference on the speed and the convenience of it all in one package."
Ray spent only 2 hours to be seen at all the various stations to complete his PHA. Major General Mary Link, the commanding general for Army Reserve Medical Command, said Operation Capital Medic began as a challenge she gave to her brigade commanders to work with local military treatment facilities and hospitals to actively practice their medical support units' go-to-war mission, medical SRP, and TMC support, while helping the Army get individual soldiers medically ready for their future missions.
This exact process of what they're doing is their go-to-war mission. So they're training for their go-to-war mission as they provide readiness services to other folks. It gets them out of the drill hall on a battle assembly weekend, and they bring them here where they can actually take care of their own service members. They're very excited about it.
Fort Belvoir Community Hospital, a Defense Health Agency facility, is an ideal partner for the medical support unit to work with. The facility is Northern Virginia's home for world-class military health care, providing a state-of-the-art facility for medical professionals to provide needed services while honing their individual and unit skills. The Army Reserve officer in charge of Operation Capital Medic is Major Erica Folks, a member of the 7250th MSU. She explains the mission's purpose and benefits.
So medical readiness is the #1 mission in the Army right now. So utilizing these services, we actually get to hit all the services that you need. This is a one-stop shop. We can get you out within 2 to 3 hours. So you don't have to utilize LHI for 2 separate appointments for an additional cost. The services we provide here are cost-effective and timely.
Operation Capital Medic, a Northeast Medical Area Readiness Support Group-led mission, will resume medical services in February. And as processes continue to be refined, the future may change for the better, allowing more soldiers to participate in the area by adding more providers and more working rooms. Reporting from Army Reserve Medical Command Public Affairs Office, from Fort Belvoir, Virginia, I'm Sergeant First Class Kenny Scott.